Welcome back to Survivor's Guide to Breast Cancer, and I am Dr. Shazia Hyder, and now we're going to talk about Survivor's Guide to Reconstructive Surgery. Now, no matter what age you are diagnosed with breast cancer, in the United States, your insurance will cover reconstructive surgery, so that's certainly something to consider. When you're younger, I would say that not having reconstructive surgery is really not even mentioned, and that's why I wanted to talk today about reconstructive surgery and say that it's something which you really need to think about, because after bilateral mastectomy, the tissue expanders are placed under the pectoralis muscle. The pectoralis muscle is that muscle sheet on the chest wall, because you can't put it under the skin. It's just not enough tissue to hold an implant, a breast implant in with. So it goes under a muscle. Now, you're taking a muscle and you're pulling it off the chest wall and you're placing something underneath, which is very painful. And I know, because I had tissue expanders placed and I had them for about 4 months, and they were so painful, and every week I would go and have them expanded a little bit more. But ultimately I had to have mine removed because I suffered side effects from radiation. So they are now gone, and I'm thinking gone forever. So which brings me to my next rule, and that is, you don't have to have reconstructive surgery. Really think about whether you want to do it or not. Consult with a plastic surgeon early on in your treatment program and get the lowdown of what you are going to experience. Ask them how much pain you're going to experience, what the procedure is like, what possible complications can happen. I seem to have got every complication that could possibly have happened, but that's just my luck. Most women don't get those problems. I've seen women have bilateral mastectomy and go completely flat and use prosthesis on the outside, so that from the outside nobody can tell that this woman has had any kind of surgery, or they just stay flat. And some women have done some really cool tattoos and just made themselves look beautiful. And so you really want to do something that is very informed. Your other option is to have your mastectomy and think about having reconstructive surgery, because you can do reconstructive surgery at any point. So you can just go through your ordeal and then say, you know what, I'm going to make that decision down the road, and I may or may not have this done. And then 6 months or a year later, you can make that decision and decide whether this is right or wrong for you. So it's not necessary to do everything at the same time. Some women do like to do a one-step procedure whereby they have a mastectomy and then they have an implant placed at the same time, and that's certainly an option. It really depends on who you are and what you want. But remember, the most important thing in your life is that you have a life, and that you are alive and grateful, and you finish your treatments and you move on with your life in a healthy manner. So that brings me on to my next rule, and that is to remember to be awesome, because you have gone through hell and possibly chemotherapy, surgery, radiation, who knows what other issues, complications. But at the end of the day, breast cancer has become a part of you, but it doesn't dictate who you are. It's just something that you've gone through. And you come out on the other side just the same person that you were before. You're just as awesome, you're just as beautiful, you're just as amazing, and you're just as capable and intelligent as you were prior to getting your cancer. So you want to move on with your life and make sure you've made some good decisions and change your lifestyle so that you're incorporating perhaps things that you did not do before you were diagnosed with cancer, and just put this down to a wake-up call, and that you're very grateful for having your health back, and be sure to continue any treatments that you're meant to be going through, screenings, and be very aware of your body and any changes that could happen to you. So know that you're part of a sisterhood now, and that women will share with you the most interesting and amazing and inspirational stories, and that you always have a part of that. You can contribute to that, and likewise listen to those stories. And so if you have any stories, please comment and share with us, and I'm very interested to hear some of your inspirational stories. Thank you for listening.